One of my favorite moments as an OCD psychiatrist doesn't always happen during the first visit. Oftentimes, it's months or years later when a patient who's been trapped by OCD reflects back on the progress they've made. And they almost always say the same things. I wish someone had told me this sooner. I wish I'd realized this earlier on in treatment. I lost so much of my life to OCD because of this. After treating many patients with OCD over the past several years, I've realized that they often come to the same insights. I'll share them with you today. Specifically, I'll go over the 5 things I hear most often from my patients that they wish they'd known earlier in their treatment. My hope is that these 5 key insights don't just better help you understand OCD, but save you the many detours that many people take on their recovery journey. But first off, for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist, and I specialize in OCD and anxiety spectrum conditions. And as always, these are just educational videos, not medical advice. And if you are experiencing any mental health symptoms, please seek the care of a local mental health care provider. And definitely stick around to the end because the last few insights are very critical and too often overlooked. All right, so the first one, you are not as alone as your OCD wants you to believe. This is probably one of the most common reflections I hear. Many people spend years thinking that they're the only ones experiencing this. They think that nobody else has the thoughts that they have. Nobody else has the level of shame that they experience. And nobody has as strange compulsions and rituals as they do. This oftentimes delays people seeking out care for years, sometimes even decades. And this is one of OCD's favorite tricks, making you believe that you're unique. You're the exception that won't get better, that can't be helped. And sure, the reality is that everybody's OCD is unique to them. The underlying mechanism, the principles are very similar from case to case. It's the same underlying core principles that propagate OCD. There's always an intrusive thought or sensation or something feeling off. A degree of uncertainty, sometimes fear. And then the compulsions, whether they be physical or mental, with temporary relief. And the relief is always temporary. But the good news is, psychiatrists and therapists that specialize in OCD, we're very familiar with this cycle and the many countless ways that it can manifest for people. I mean, the amount of times I've had patients very shamefully sort of lean in and divulge what they've never told anyone, their obsessions, their ruminative thoughts, their compulsions that seem very odd to them. And I can guarantee you, sometimes I do hear something that's new, but OCD no longer surprises me. It's always the same things coming up, just in different forms. So OCD is a lot less special and unique than it makes you want to believe. And seeking out help earlier despite some shame is key. Next, stop trying to win the fight. This is probably the most important part of OCD recovery. Not fighting with the intrusive thoughts, not fighting against your OCD, trying to white knuckle it. Because before starting treatment, many people think that seeking care for OCD means getting rid of the anxiety, finding ways of rationalizing or fighting off the intrusive thoughts. But in reality, that's just what keeps you getting stuck in the OCD thought spiral. Because you're not going to find the answer. You're not going to find full resolution to your doubt, your intrusive thoughts. That's not going to happen. And that sounds very, very scary to people. But for those who are in recovery, after a while, that also becomes the mental freedom that they are able to access. They don't need to find certainty. You don't need to be sure of something. And that's very anxiety inducing. But as you go on in treatment, that also becomes the source of freedom. You don't have to keep fighting. You can allow the intrusive thoughts, the anxiety to arise and pass. Because the false promise of OCD is if you do the compulsion one more time, get reassurance just one more time, you'll get some relief, you'll be safe. But that just keeps you getting stuck in the quicksand of OCD. And the next one is that finding the right therapist and sometimes psychiatrist is much more important than you may think. Because something I hear all the time is someone's been in treatment, someone's been seeing a therapist, a psychiatrist for years, sometimes, yes, even decades, and things aren't getting better. Maybe a little bit better, but then definitely not the symptom resolution that they were hoping for or would like in their life. The problem isn't that the person isn't motivated, because they are showing up, they are wanting to get better, but they're just not getting the right treatment for their particular condition. And this can be for many reasons. One, OCD can be tricky to recognize. So if a therapist or psychiatrist isn't trained in it, isn't attuned to the ways it can manifest, they might miss it altogether and be treating something else, and that might be leading to your symptoms not improving. And to be clear, that's not a criticism of those providers. They're usually very well-intentioned in trying to help, but you don't know what you don't know. And the danger is that traditional talk therapy can sometimes make OCD worse. And why is that? Well, that's because OCD loves analysis. It loves reviewing thoughts, your feelings, trying to get a better sense, a deeper understanding of yourself. That is just fodder for the OCD. It's fuel for it. And you might just be ruminating out loud and engaging in obsessions and mental compulsions in therapy just out loud. And that could be making your symptoms worse. So if therapy is starting to feel like an exercise and repeatedly analyzing intrusive thoughts, trying to find certainty about how you feel about something, examining the meaning behind your fears, your thoughts, then that might be a sign that you might need to shift your therapy approach. And then once people do start therapy that is tailored towards their OCD symptoms, like exposure response prevention, ACT therapy, CBT therapy, and other forms of therapy that are particularly tailored towards OCD, their symptoms start to drastically improve. The next one is that many people wish they'd been open to medications earlier on. Now, to be clear, not everyone with OCD needs to be on medications. Some people do well without it in just the therapy alone. But for many people, starting a medication can really improve and speed up the recovery process because they are able to engage better in the ERP. Their symptoms reduce. It reduces just the mental load of the intrusive thoughts and the need for compulsions. And of course, as a psychiatrist, the patients I see with OCD are on medications, at least some dosage of them. And I hear all the time how they wish they'd considered even a small dose of something earlier on because of the progress they've seen once they did start a medication. And I find that people with OCD can be particularly hesitant and concerned about potential adverse effects of medications. And this can include things like, will I be on this medication forever? Will it cause side effects? Will it change who I am? And all of these other concerns. I think it's always important to talk to your doctor about this and not fall into the trap of reading through dozens of Reddit posts, because I think OCD always wants reassurance. So people will spend a lot of time reassurance seeking online around medications, and that'll also be a barrier to starting them. And once they do start them, it's rarely that it removes all of their OCD symptoms, but it can quiet the intrusive thoughts, reduce the urgency to engage in compulsions, and help them go further and deeper in their ERP work. I describe it like being able to turn down the volume while you do the work for the OCD, so you can be more present during it. And finally, the last one, recovery is bigger than just OCD. It's not just about the medications, the therapy, and the understanding around OCD. It's about paying attention to your entire life, making some changes to just help your health and your mental health. This is a really important one because OCD has a way of shrinking your life, making you more isolated, reducing the kind of activities you engage in that maybe you once enjoyed. And recovery involves reversing that process. So focusing on your health, expanding your relationships, your friendships, and also your sleep, exercise, diet, all of that has an influence on the severity of your OCD symptoms as well. So making sure you pay attention to those things. Work with your therapist to improve your sleep, get more exercise into your week, and just eat healthier as well. And then reintroducing the things that make you you. So creative hobbies, sports, connections, whatever it is for you. And of course, I can't say enough about how integral it is to reduce screen time. Whenever anybody is doom scrolling, it reduces their focus, increases their distractibility, and also makes intrusive thoughts louder and more persistent. And then reducing alcohol and drug use is also critical. So basically just caring for yourself in a very holistic way. And oftentimes people wish that they attended to these things sooner because it does help so much. So these are the 5 things that many of my patients wish they'd considered and knew about earlier in their recovery. So if you or someone you know has been struggling with OCD and anxiety, I hope this was useful. I hope this provided some insights and some hope. And again, thank you so much for watching to the end. I greatly appreciate your attention. Hope this was helpful. And I look forward to seeing you next week in another mental health video. Thanks.